didn't realize is that smart patients always bring like a written list of their medication, like a paper list. They do? Yeah, on paper with doses and the last time they took one. Oh yeah, because pharmacy takes forever if we don't get it right. Yeah, exactly. Because like if we don't know the doses or the time that you took them, like it slows us down. It takes us a bunch of time. We miss doses. Plus you have so many nurses that you encounter from like triage to like all the way to getting a room. It's better to just have a list all the time. Like I said, smart. I am the mystical Miss Jacqueline, now available at CVS Minute Clinic. Come child, let me tell you your future. I just need to know if my insurance is going to cover Manjaro in the new year. Let us consult the tea leaves. But also, what is your insurance? Blue Cross Blue Shield? Shh, I knew that, just checking. Now, did you need a prior authorization when you got it last year? No, they actually covered it right away, first try. Really? That's as the leaves have already explained to me. Now I'm looking at the leaves. I'm seeing your future. The answers are coming through the fog. Ah, yes, the leaves. They speak to me. They say once your deductible is met, your deductible is $6,000. Jesus Christ! Once it is met, your medication will be covered. Yes. But wait, the leaves. They speak to me again. They say that your stars will fall out of alignment in March. And then your coverage will change and you will only be covered for Wegovy. Crap, I thought I'd be in the clear. Would you like to know the side effects in your future? I don't think I want to know that. Well, I see ginger is in your tea, so Zofran is in your future. Welcome to pre-op. I'll be your nurse today. And whoa, babe, what's with the crying? I'm sorry, I've never been under anesthesia before and like, I don't know what's gonna happen and I'm just really, really scared. Would it help if I told you absolutely everything that's going to happen? You wouldn't mind? Not at all, babe. I'm going to walk you through the whole thing. So the first thing that's going to happen is you're going to get an IV. Are you afraid of needles? No, not really. Good. And even if you were, anesthesia nurses are kind of the best at getting veins, so you would be in great hands. Next, we're going to do some paperwork, totally boring. And then your anesthesia nurse or physician is going to come in. They're going to ask you some questions. They're going to look at your throat and inside your mouth. And it's kind of weird, but it's totally fine. And then your surgeon or your surgeon's assistant is going to come over and they're going to talk you through everything that's going to happen in the procedure. They're going to make sure they're operating on the right limb, organ, body, and they're going to answer any other questions you have. And if you're still feeling nervous, you can tell the anesthesiology team or the medical team that, and they'll probably give you something like Versed, which is a sedative to help you calm down before the actual procedure. And then the next thing that's going to happen is a nurse is going to come in and they're going to take you to the operating room. You're going to stay in this bed right now that you're in, and you're going to be wheeled into the operating room. Once you get there, they're going to have you scoot over to a large metal bed. And it's going to be a little bit uncomfortable, but don't worry about it. You're not going to feel it in a couple of minutes, so don't worry. Now, the operating room can be kind of hectic. There's a lot going on at once, but everyone is there for you, okay? So you just got to speak up. You can start talking. You can say to them, hey, I'm nervous, and somebody will come over and they'll hold your hand, honey, and they will walk you through everything that happens while you're in the operating room. And at some point, the anesthesia guy is going to come over and they're going to, or girl, and they're going to come over and they're going to put a mask on your face and they're going to tell you to take a couple of deep breaths. And that's when you're going to start to fall asleep. And I promise you, you will be asleep for this procedure. You will not be awake. You will not wake up in the middle of the procedure. We have some great anesthesiologists here and it's going to be totally fine. It's okay to be scared. You're allowed to be, because you know what? We are not scared. We know exactly what we're doing. We are totally on schedule and everything is going to be just fine. So anytime that you're scared, just tell us and we'll be right here.